Ladies and gentlemen, I would like to talk about the topic investigating the relationship between periodontal conditions and systemic diseases. I am Kitti Hohl, a prosthodontic resident and a first-year PhD student. Let me introduce my supervisors, Ákos Zsemberi and Zsuzsanna Helyes, and our senior advisors in the topic, Réka Fazekas and Zsuzsanna Kis. And my scientific methodology supervisor is Lőrinc Privalski, and our scientific methodology expert is Alexander Schulze-Wenning. My vision is to reduce the incidence of systemic diseases by appropriate periodontitis management, and to achieve that, I would like to determine causal link between periodontitis and systemic diseases. I have two ongoing projects right now. One of them is a systematic review and meta-analysis, and the other one is a registry analysis project. The title of my first project is Investigating the Prevalence of Liver and Pancreatic Diseases in Patients with Periodontitis. Periodontal disease is a set of inflammatory conditions affecting the tissues surrounding the teeth. But why is periodontitis so important? It is the 7th most prevalent diseases worldwide with 1 billion cases. There is a wide range of oral bacteria with more than 715 species, which can reach other organs through ingestion, bloodstream, and immune cell migration, causing extraoral consequences. So liver and pancreas might be damaged. It can affect the liver, causing chronic liver diseases, including non-alcoholic fatty liver disease, cirrhosis, and hepatocellular carcinoma. And it has been recently shown that there is a higher risk of non-alcoholic fatty liver disease, and that oral pathogens can contribute to the development and progression of non-alcoholic fatty liver disease. Oral bacteria can also affect the pancreas. So presence of Porphyromonas gingivalis and Aggregatibacter actinomycetam comitans increase the cancer risk by 50%, suggesting that oral bacteria persist the development of cancer. So our aim is to discover the higher incidence of liver and pancreas diseases among patients with periodontitis. So what we want to know is, does periodontitis increase the risk of liver and pancreatic system diseases? And our population will be the general population exposed to the presence of periodontitis compared to the absence of periodontitis. And our outcome will be prevalence of liver and pancreatic diseases. Our clinical implication is periodontitis management might decrease the incidence of liver and pancreatic system disorders. And our hypothesis is periodontitis, mainly caused by a certain bacteria, can contribute to the development and progression of liver and pancreatic diseases. Through preliminary research, I haven't found any Prospero registration or meta-analysis, but I have found some similar meta-analyses related to non-alcoholic fatty liver disease and pancreatic cancer. Here you can see some of my key articles using the population adults or general population exposed to a periodontal condition compared to no periodontal disease, and their outcome was a higher risk or incidence of the disease we want to talk about. Here you can see my search key. I designed two domains. The first one is related to the periodontal condition, and the second is to the diseases we want to talk about. After the duplicate removal, 10,000 articles has remained, and right now we are doing the title abstract selection with a deadline of the 20th December. The title of my second project is Investigating the Risk Factors of Medication-Related Osteonecrosis of the Jaw using the Methodology Registry Analysis Project. Medication-related osteonecrosis of the jaw affects 1 to 10% of people, and it is a potentially preventable side effect of using drugs like bisphosphonates, denosumab, and anti-angiogenic drugs, which patients get for conditions like bone metastasis, primary bone cancer, osteoporosis, and myeloma multiplex. And it is a really severe condition, impaired with masticatory malfunction, problems with speech, swallowing, and it affects the quality of life. But we can prevent this from happening with optimization of oral health, extraction of non-restorable teeth, and patient education about the potential risks. These risks can be systemic or local. A couple of the systemic risk factors are, for example, malignant tumors or comorbidities, and it can be also drug-related risk factors like IV administration or high cumulative dose. And some of the local risk factors are poor oral hygiene and pre-existing inflammatory dental disease. And our aim is to assess and compare the importance and co-occurrence of risk factors of medication-related osteonecrosis of the jaw. What we want to know is what are the major risk factors and comorbidities of the condition. Our population will be patients with this disease exposed to presence of drug-related risk factors and systemic and local risk factors. And their outcome will be clinical features of the condition, including severity and staging at enrollment. And their hypothesis is certain risk factors increase the stage of medication-related osteonecrosis of the jaw. And their clinical implication is selecting high medication-related osteonecrosis of the jaw risk patients and determining prevention options. And we are planning to submit the first project until September 2025 and the second until February 2027. And I would like to finish with a quote of Albert Szent-Györgyi: "Research is seeing what everybody else has seen and thinking what nobody else has thought." Thank you for your kind attention.
Thank you for your nice presentation, and the discussion is open. Have you any question?
First of all, I would like to thank you for this really amazing presentation, and I would like to ask, do you know any other diseases that can be affected by periodontitis?
Thank you. Yes, it has been already shown that there are several conditions associated with periodontal disease, such as cardiac, respiratory, renal diseases, and autoimmune arthritis, and diabetes. But in this case, if there are any alterations in the oral microbiota, it can modify the intestinal microflora too, thereby increasing the risk of diseases.
Thank you. This really shows how important this topic is.
Thank you.
Other question? György?
Kitti, thank you for your presentation. I was wondering about the factors. Which is the top 3 or top 5 factors that is related to the medication-related osteonecrosis of the jaw?
Thank you. I would say the drug-related risk factors are the most important because, as I mentioned, these conditions prevalence ranks from 1 to 10%. And this happens because of the administration route. For example, if the patient received the medication through oral administration or IV administration, and the duration of the treatment also matters in this case. So, for example, in case of an IV administration and longer duration of the treatment, it is more likely to develop this severe side effect.
Thank you.
Thank you.
Thank you.
Okay. Other questions from this side? It's very inactive.
Thank you for a nice presentation. So I have a question about the first project. Do you plan to exclude patients with any additional risk factors for pancreatic and liver diseases? And did your key articles exclude them from the analysis?
We haven't excluded those patients, but I know that there are some risk factors for non-alcoholic fatty liver disease, such as obesity, insulin resistance, and other conditions that can promote a systemic inflammatory response. And for the pancreas diseases also, there are some risk factors like alcohol consumption, smoking, also obesity, and periodontal condition also. But we haven't excluded those patients.
Okay, thank you.
Okay, my co-chair also have a question.
Thank you very much. I would like to congratulate you, especially on your second project. We don't see all that many registry analysis in TM, and I would like to ask if this is a pre-existing registry, or are you setting up the registry?
New one, thank you. And I am sharing that project with Sára Szabó. We will do that.
I wish you good luck. And it will be a lot of work, but it will be worth it.
Thank you.
If there is one thing I really suggest, because when you set up a registry, it's very important to try to think of all the risk factors before doing so. And I would suggest you to include D vitamin deficiency as well, because it's emerging as a new risk factor, a newly found risk factor of MROIN. Thank you.
You.